People often think that high blood pressure is just a number that they get read at the doctor's office. I think what people need to know is behind that number is risk of a heart attack, risk of a stroke, things that could end your life very quickly.
My name is Dr. Doreen Rabi. I'm a clinical endocrinologist here at the University of Calgary, and I'm also the co-chair of the Hypertension Canada guidelines for the measurement, prevention, and treatment of hypertension. We are very concerned as physicians about high blood pressure because we know that it increases the risks of heart attacks and strokes. Hypertension is the leading risk factor for preventable death in Canada. If we can find cases of hypertension and effectively treat them, we can improve the survival.
My name is Kelsey Heffernan. I'm a registered nurse. I work at the Children's Hospital specializing in mental health. Over the past year, I got engaged, which was very exciting. I'm planning my wedding for next October. Got a puppy in the last year, which has also flipped my life upside down. And over the last year, I was diagnosed with hypertension, which was also a flip upside down in my life.
An estimated 7.5 million Canadians have hypertension, also known as high blood pressure. As the symptoms of hypertension are typically silent, blood pressure measurement or monitoring is key to detection.
Blood pressure is something that naturally varies from moment to moment and day to day. So when we're measuring blood pressure in clinic, it's really important that we get a series of measurements to determine if someone has clinically important elevations in their blood pressure or if they're just having a bad day.
I have many chronic conditions that require me to go to see my endocrinologist, Dr. Rabi, as well as my family doctor quite frequently. When I was going to those visits, they were flagging that my blood pressure was high, and we weren't sure if it was the nerves of being at the doctor's office or whether it was an actual concern. So I started taking my blood pressure at home in the most calm of settings and realized that no, my blood pressure was definitely trending high and we needed to address it.
If your blood pressure is between 140 and 160, that suggests that you're certainly someone who's at risk for developing significant hypertension. And this is a point where we definitely want to talk to you about things that you can do to reduce your personal risk of developing hypertension. Another criteria that we take into account when making a diagnosis of high blood pressure is what is your general health? Do you have any other risk factors for complications related to hypertension, such as kidney disease or diabetes? And that will adjust our threshold. I think it's really important for all patients to know that they can play an extraordinarily active role in the management of their own blood pressure. There are a number of things that they can do at home that don't involve medication that will have very important and beneficial effects on their blood pressure.
Angelique Berg is the Chief Executive Officer with Hypertension Canada.
Hypertension Canada is the only national nonprofit organization dedicated solely to the prevention and control of hypertension or high blood pressure and its complications. We are powered by an expert network of clinical and scientific experts across the country who lend their voices and their expertise to us to create the clinical practice guidelines for hypertension. Our clinical practice guidelines are rigorously reviewed and regularly updated, so we're always at the leading edge of hypertension treatment.
Lifestyle changes can go a long way toward controlling high blood pressure.
The great news is that blood pressure is highly responsive to the things that we do every day, our lifestyle choices, our diet, exercise, and other factors.
In particular, patients should be avoiding salt, so keeping their salt intake to less than a teaspoon of salt a day. They should be eating a diet that's rich in fresh fruits and vegetables. They should be trying to exercise at least 30 minutes a day, most days of the week. And they should try to stop smoking and limit their use of alcohol.
Some of the things that I do to take care of myself are enjoying time with my fiance, remembering that life is too short to not enjoy the little moments. I have a puppy, so I love to walk my dog. I eat healthy because that helps manage my other chronic conditions and the hypertension, and spend time outside. I'd like to hike, spend time with family and friends.
One of the challenging things is that making lifestyle changes sounds really easy, but it's a little more difficult when we go to put that in practice. So we're really excited about the Get Down BP program. The goal of the Get Down BP program is to get Canadians thinking about their blood pressure and thinking about how to manage that every day for lifelong health. The only way that we know if we have high blood pressure is to measure it.
Home monitoring of my blood pressure can be annoying, but also convenient. It's nice to be able to take it at home. I check my blood pressure at least 3 times a week. When I was titrating my medication and figuring it out, I was doing it daily, remembering to write it down. Thank goodness we have cell phones now. I could log it all and have that data.
It's especially important to use the most accurate methods and the most accurate devices available.
As home blood pressure monitoring results may vary depending on the device, it is recommended to use a device that has been tested and validated to allow more accurate measurement.
What validation means is that that device has been validated as accurate against the gold standard research monitors and carries a logo from Hypertension Canada that signifies it has been validated.
A diagnosis of high blood pressure can be seen by both patients and healthcare professionals as an opportunity to change outcome.
Hypertension is actually a really helpful red flag for us. It tells us that we're at risk for a number of chronic diseases that can really damage our health.
Hearing that I had high blood pressure, hypertension, was like, oh, here we go, another thing. I was also thankful to know that I had hypertension, because often you don't find out and it's just something that ticks along until it becomes a really big problem. So I felt grateful that I was diagnosed, but also overwhelmed that there was something else I needed to manage.
In the last 2 years, we've made some significant changes to our guidelines regarding blood pressure management, particularly if you're an individual at increased risk for adverse outcomes such as heart disease or stroke. And our guidelines now say that if you're an individual that has a pre-existing diagnosis of heart disease, or if you're someone who's at particularly heightened risk for heart disease, so if you have kidney disease or you're an older adult, we actually are now recommending that we treat your blood pressure quite aggressively, that we start treatment if your blood pressure is consistently above 130, and we treat to a target of 120 millimeters systolic.
When lifestyle or habit changes aren't enough, we might require medication to keep our blood pressure within a safe range. And it's especially important to stick to that treatment too, to stick to our lifestyle changes as well as our medical treatment to be sure that our blood pressure is healthy and we prevent the complications to which it leads.
But making sure I took the pill every morning at the same time every day, making sure that even if it was a busy week, I made sure to take my blood pressure. My fiance was really good for that as well. We'd be sitting on the couch, he'd say, we haven't taken your blood pressure in a while. I think we should probably check. So it was a combination of lots of things helping me manage it.
When we initiate treatment for high blood pressure, we always have to keep in mind, what's our goal blood pressure? What's our target? What are we trying to achieve with this therapy? Conventionally, we have targeted a blood pressure of 140 in most adults without any other significant health issues. However, recent trials have suggested that more intensive or tighter blood pressure control may have greater benefits in certain populations. So if you have diabetes, we tend to target a lower blood pressure of 130. And if you have a history of heart disease, kidney disease, or you're an older adult, we believe, based on current evidence, that a lower blood pressure, such as less than 120, is going to provide you with increased benefits. When we're making therapeutic choices, we can really try to tailor it to the individual patient to make sure that the treatment program is going to be something that suits them and is going to be well tolerated.
Having good blood pressure control takes something off my plate, which is something that I really appreciate when there's lots of things on your plate with life, with work, with my other chronic conditions. Just knowing my hypertension's under control is one thing off my plate that I don't need to worry about.
One of the biggest innovations in high blood pressure is the introduction of therapies that make it easier and easier for patients to treat their high blood pressure.
In particular, in the last year, our guidelines are now recommending that we try to streamline therapy as much as possible to make adherence to therapeutic regimens easy. Two ways that we can do this is by focusing on using single pill combination therapies, where you get 2 pills in one, or using long-acting formulations that allow you to reduce the number of blood pressure pills to 1 per day. Both of these strategies are really effective at getting people on their medications and staying on their medications. The good news is we know more than ever about hypertension. We know how to recognize it and we know how to treat it. If you're diagnosed with high blood pressure today, we have a number of options available to you to effectively treat your blood pressure and get you on your path to a longer, healthier life.
Life is short, and I think everything happens for a reason. So if you went to that doctor's office and there was a high reading, there was a reason behind that. Maybe it was to keep you from 5 years down the road having a heart attack and missing out on important things in life.
To learn more about recent guidelines for diagnosing and managing high blood pressure, visit the websites below and/or speak with your doctor.